get started and then I'll be passing it over to David, but I'll start by just introducing myself. My name is Julia. I've been with OSI for over 11 years now, and I support our operations team and lead our implementations. And so happy to be here with you today. And I'll pass it to David to introduce himself.
And thanks, Julie. Just prior to David stepping in, I just want to thank everyone for attending today's webinar. My name is Michelle Oxbury. I'm the Disability Coordinator here at OASIS. Organizational Solutions, Inc. is the short-term disability provider for OASIS. And today they'll be providing a webinar on the short-term disability process and next steps. So I'll pass it off to David from there as well. Thank you.
Hello, everyone. My name's David. I've been supporting the OASIS account. I'm the client lead for OASIS at OSI and have worked in disability management for over 4 years, training in kinesiology and formerly as a paramedic, working in primary care and public health interventions as well. Happy to be here today to support the OASIS team and go through an overview of short-term disability with you. Thanks for joining us.
Okay, so we will get started. For start, I did want to just start by introducing OSI a little bit. Sorry, David, I don't think I can actually move the slides. I think you can do that. I'm still seeing the cover slide. Thank you. So agenda today, we'll talk a little bit about who OSI is. We'll go through the highlights of what the care management program is about, and then break it down into the process steps, which is claim initiation steps, the adjudication and care management. We'll briefly touch on the COVID-related claims handling. We aren't experiencing as many as usual in the past years, and then return to work process, followed by long-term disability transitions. Next slide. So OSI is a Canadian organization. We have offices all across Canada. We offer services in both official languages. We've been in business since 2003, so we are celebrating our 20th year anniversary, which is a really great milestone for us. One of our distinguishing factors, I think, is that really disability management is all we do. Everything we do is focused on the continued growth and expertise in the disability management and workers' compensation fields. And our team is really highly experienced, and majority of them do have a healthcare professional background. And as well, we do have paralegals, which mostly support our workers' compensation side. But our team is really, really skilled. And so, you know, even if your employees may be dealing with a recovery facilitator that might specialize in a more physical type of condition, they only have to, you know, well, before COVID, walk a few steps away and now pick up the phone and call another individual who might specialize. So we really work as a team. One of our core values is teamwork. And I think that that's really something that distinguishes us from other providers. Everything we do is focused on our motto, which is the right care at the right time for the right outcome. And so we carry that motto through in all of our claims management, focusing on that employee's well-being and making sure that whatever they may be going through, that they're guided towards the right care to help them get better and get back to a normal life, which now also then includes work as part of a normal and healthy life. Next slide. So why have a program? Why is it important? It's really important to show your concern for the well-being and recovery of your employees. Oftentimes employees, when they go through situations and are affected by medical conditions and they lose that connection to the workplace, it really creates a lot of anxiety for them. And so having a program like this really just shows them how much you care for them. And OSI maintains a little bit more of that employment relationship with them, making sure that they feel reassured and helping them through those difficult times so that ultimately they can get better faster, as fast as possible, or in those more rare situations where they need to transfer to LTDs, just making sure that all of those administrative pieces of the claims management happen seamlessly so that they don't have to have any sort of excess stress going through this process. It's also important to just provide a timely assistance and reassurance to employees and managers alike. There's lots of questions when somebody is requiring time away due to medical reasons. And so we're going to be there to answer questions and help guide all parties that are involved. Helping that employee navigate the healthcare system and recovery process. It's not always easy to sort through, and these employees are affected by some condition, and so it's difficult sometimes for them to advocate for themselves, and wherever we can, we assist in advocating for them if we can. Where we feel it's necessary, we may be able to access preferred providers in some very complex situations. And our program is really focused on a planned and proactive monitored approach to disability management. So really trying to get ahead of things. We want to get involved right away from day one as much as possible, because that's where we know that we can really influence that individual situation, guide them to the right resources and the right treatment so that they can get better sooner and get back to work sooner. And like I mentioned before, having this type of program will really just help maintain that connection to the workplace so that the employees don't feel completely disconnected. And we do encourage that managers keep a relationship with their employees. You know, it doesn't have to be about medical situations, but letting them know that you care, keeping them informed of any, social situations that may be happening in the workplace. And again, mostly just letting them know you're there and that you care for them. I think everyone can appreciate even going on vacation for 2 weeks and coming back to work. You feel a certain level of anxiety just knowing what you're going to come back to and what's changed and what's different. So keeping that connection is really a best practice. We feel that helps people feel a little less anxiety when time comes to return to work. And of course, one of the main positives of having a program like this is that it maintains confidentiality. And so employees won't be forced to share any medical information that they're not comfortable sharing with their employers. And so this way they have another avenue to share everything that's going on with them in their lives without breaching that confidentiality of medical information. Next slide. So our approach is really to be focused on abilities, changing that mindset from the disability mindset to being capability focused and really that early intervention. We like to get involved, like I mentioned, from day one as soon as possible so that we can really influence that employee's care and recovery and return to work. Everybody's capable of doing something, and it doesn't mean we have to be 100% to be at work. There's always something that someone can contribute to, and we really keep that philosophy and mindset in mind. So our recovery facilitators, those are the individuals who will be managing the claims and working with the employees and yourselves. They will be discussing with the employees, their physicians, obtaining medical information, accessing nature of absence, gathering information, understand what the restrictions and limitations are, and just making sure that that treatment plan is really based on best practices and focused on a return to work when it's safe to do so. Next slide. Okay, so really one of the most important parts of your role as an employer is to initiate the process, because without you, we don't get to know when there is somebody that might require a medical leave of absence. So once the employee advises their employer of their absence, and you all may have different wait periods. So whenever you know that that absence is going to extend beyond the wait period, as soon as you know that, then we want to make sure that this process is initiated. So we don't have to wait until that wait period is actually passed. If that employee has verbally told you that their absence is going to go beyond that wait period, then really we would expect that this process start right away. And so it starts with you providing a package to your employees, and that package will include an instruction sheet, just benefit details, a letter to the physician as well, and an attending physician statement. And that's the forms that we are going to need to adjudicate the claim. But once that part is done and that package has been given to your employee, we ask that you immediately submit the claim to OASIS. And so you'll have an employer statement form, a plan sponsor form that needs to be completed and sent to OASIS as quickly as possible. It's really important that that gets to OASIS quickly so that they in turn can notify OSI of the absence. And ultimately, at that point, OSI will be able to reach out to the employee and discuss what's going on, how can we help them, how can we guide them to the right resources and care, and also look at modified work opportunities. Sometimes we don't necessarily need to have the medical to know that somebody's able to be back at work with some form of modified job duties. And so we really want to be speaking to those employees as soon as possible to get an understanding of what's keeping them away from work. We may be reaching out to you as well to discuss a little bit more about their job demands and what possible modified work will be available to them. But I think the most important message here is to really focus on getting that notification, that statement form completed and sent to OASIS rapidly. Our data has showed us that it is taking quite a bit of time for those claims to be referred. And so it just means that OSI is really only intervening sometimes after 30 days of the absence already starting. And the later we start, the later we can actually help that individual, the later we'll get the medical information, and the longer it will take for you to get a decision, and therefore the longer it will take to also influence a return to work. So I think that's the most important message here, is to just please do your best to provide that employer statement form to OASIS as quickly as possible, so that then OSI can do their job and ultimately help you to manage that absence. Next slide. We did circulate some posters, I believe, last year, and these are always available. So if you don't have them, want more, please reach out. We can always provide more, but these were just done for reminders so that everybody had a little quick summary of what they need to do if ever an absence comes up. And I will pass it over to Dave now, who will go through the process.
Thank you, Julia.
All right. Hopefully it's a bit nicer to hear from multiple people throughout our presentation. Lots of writing, and I'll try to make this as fun as possible, even though disability is definitely something that's serious and deserves attention, but it can sometimes be something we don't want to think about. But in case it does happen, it's important that you're aware that there is a process in place for you, that there are solutions and people you can reach out to. So once we've received the claim, OSI will communicate with the employee. The expectation is within 1 business day that we've received that notification to provide an introduction, explain our role, and discuss any medical details that are available. And we ensure that the employee is aware that confidentiality is maintained throughout. And when we provide decisions, that we do not provide any identifying information to the employer, just length of absence, how long that absence may take place, and if there's an opportunity for modified work, what abilities we'd be looking at and what abilities are currently available. And we would facilitate that process. The return to work decision, ultimately, whether modified work is available is something that's discussed, and it's an employee-employer decision, but we help facilitate that process. We introduced that an attending physician statement is required, and this is to be completed by a medical doctor that is registered in the province that the employee is living in. There's been rare cases where somebody lives somewhere but their family doctor is elsewhere, but as long as it's a Canadian physician that is in good standing with their regulatory college. Upon receipt of medical information, OSI will review and analyze the information according to industry best practice and company policy. So we'll assess, make sure that that documents are signed, they're completed by the appropriate provider, someone who is registered, that there's a confirmed diagnosis, appropriate treatment, that there are symptoms that are matching, that there are functions and capabilities and barriers that match the diagnoses as well. OSI then manages the claim in accordance to STD plan that has been designed, the short-term disability plan that's been designed and elected to by the employer, and that this is administered on the OASIS side. So we're looking at objective evidence, objective medical information. We do consider the subjective reports of what the employee have told us about their observations, the information that has been reported to us initially. And then we also take the objective medical information to then analyze it and look at what we would generally expect to help guide our process. And all decisions are reviewed by multiple eyes. So it's never subjectivity. It takes away the subjectivity from a decision being made. The SCD care management process. So OSI assists from the moment we receive the claim until return to work full has been confirmed. So that means gathering updates from the employee as needed, gathering updates from the healthcare providers as needed, and communicating with the employer as well regarding how workplace accommodations have been going, if there's progression to be made in a modified return or gradual return to work plan. And if there are any issues that come up on either ends, we're definitely there to assist throughout the whole process. And the goal is to have someone, once they are ready to go back to ready, and the claim does not close until somebody's returned to regular hours and regular duties. OSI ensures confidentiality of all medical information. That's either self-report, our notes that we make throughout our claims, the medical information we receive from the employees' healthcare providers. And when we do share updates to the employer, they again do not include any identifiers or medical information that would be in breach of PHIPAA. OSI provides regular updates and assists in the development of a return to work plan. But again, ultimately, it's employee and employer agreement based on what is available and based on whether the employee would like to proceed. They can always accept or not accept the offer and appeal a claim decision. COVID-related claims. So the standard, if there's an absence that's been less than 14 days, that a questionnaire would be required, and an absence that is more than 14 days. Still medically related, although pandemic has changed and shifted over the last 3 years. An APS would still be required. I mean, generally, if someone is unwell for more than 14 days and there's no improvement, they would seek medical attention at that point, and that's the expectation. OSI will plan to return to work based on provincial guidelines, based on employer policy. If someone needs to be symptomatic, these things have shifted as well throughout the pandemic and changed from province to province. I guess we are more of an endemic phase right now of COVID-19, and policies have all as well shifted. So, and this is something that's done on a case with a policy, with the employer's policy in mind as well. If the employee is able to return to work at the end of their required self-isolation, based on what the guidelines may be at that time, an attending physician statement will be required to follow the STD process. So whether the medical absence was medically substantiated, supported, otherwise it would be considered if it's excused with an attending physician statement. If there's evidence that it was medically supported, it would be a supported absence, and it wouldn't count towards the attendance record, versus the other option where if it's unsupported, unsubstantiated, and non-appealed without any objective information, it would be something that the employer could consider as a non or culpable, and everyone would have their own policies with next steps on that. That would be an HR thing, and we would not step into that lane. We stick to disability management and medical absence, medical accommodations only. OSI appeal process. So if an employee disagrees with the decision, whether it's an absence or accommodation decision, they have within 5 business days of the appeal of the claim decision, or the non-support decision, to appeal and provide a written statement that they intend to appeal. And then within 10 business days of the decision, they have an opportunity to provide new and unreviewed medical information. If new and unreviewed medical information isn't provided, the appeal can still go on with what is on file, and this would be looked at by an appeal committee. And again, the medical information must be current, detailed, clinical findings, treatment plans included, objective medical information is being assessed that would support the need for total disability and total absence, or a need for a medically supported workplace accommodation. And this is done by 2 independent recovery facilitators that are part of our appeal committee. There's our senior recovery facilitators, and they have not been involved in the claim up to that point. In cases where some absences and short-term disability claims, there is an opportunity to where the return to work will take place outside of that short-term disability period, that initial phase. Claims may be transferred to LTD as well. So the long-term disability provider, being Canada Life, will review the claim, and they will assist with the return to work process at that point. OSI will assist with transferring all of the medical file that is to date available to us, and assist the employer in the notification of a statement being completed. And I mean, OASIS will as well support the transfer of LTD, the transfer of the file to an LTD provider. Michelle, did you want to add anything about the LTD process or the transfer process?
No, not generally. In the event that a claim is expected to extend beyond that STD maximum, there is an 8-week trigger. So OSI would actually forward that information to Canada Life 8 weeks prior to that STD maximum or short-term disability maximum period. And Canada Life would wait on the employee statement to be received. And once they do receive that, they would review and provide an update on the claim status beyond that period. But this would be on a case-by-case basis, and further details would follow if and when at that applicable time, specific to that individual's claim. Thank you.
Thank you, Michelle. And that concludes our presentation. Definitely appreciate if anybody that is here would like to ask any questions. I don't see any in the chat at the moment, but we'll allow some time for them to come in, or if you feel comfortable coming on the mic, you're definitely welcome to unmute yourself and ask your question.
Thank you. And just speaking to that, thank you to Julie and David for the webinar today. Thank you all for attending, taking the time out of your day to attend today's webinar. Of course, if there's any questions whatsoever, please don't hesitate to contact OASIS directly. And I just want to highlight the importance of the early or timely claim submission piece. So if you do have an employee that will be off work for medical reasons, please do contact myself, Michelle Oxbury at OASIS, and we can provide further details regarding next steps and applicable forms thereafter. So thank you all again. Have a wonderful day.
Michelle. Thanks, everybody.
Thank you.
Thanks, Michelle.